That's good?
Welcome, welcome.
Welcome, thank you. Well, good evening, everybody. Thank you for being here, especially in the middle of the holidays. I know you all have lots of things to do during this period of time, whether it's get out your holiday cards or do a little holiday shopping, or maybe just relax before the holiday rush. So I appreciate it that you would take the time to spend this evening, at least part of it, here, talking about this very important race for the state Senate seat, currently represented by, of course, our Senate Pro Tem, Darrell Steinberg. You know, for me, I was a teenager in the 1960s. And I see a few people in the room who share that characteristic with me, but I see a whole lot of others for whom what I'm going to talk about for a moment is something that they probably just seen videos of or read or got taught in their history class about. But it was a time of enormous social upheaval and tumult. It was a time of undeniable tragedy, the assassination of President Kennedy, of course, that we marked the 50th anniversary of just a few short weeks ago. The assassinations of Robert Kennedy and Martin Luther King. But at the same time, it was an era of hope and expectation of a future that would hold equality and equity, inclusion and opportunity for all. And from that formative period came my decision and my conclusion to pursue a life of public service. So it was in 1977 that my wife and I, Marge, came to Sacramento with the purpose of doing what we could to try to be part of realizing that hope and that expectation that had been so prominent during the course of our teenage years. It's the hope and expectation that led me to be part of a statewide project to help increase access for all to the courts through such things as translating court forms into English, into languages other than English. It was that hope and expectation that led me into the courtroom to stand up and be an advocate for those who otherwise would never have had a chance for justice. It was that hope and expectation that led me into elective office, where I was fortunate enough to serve for almost 17 years as a member of the Sacramento County Board of Supervisors. And over that span of time, with that opportunity, came also the ability to make a difference on those things that matter, to realize that hope and that expectation. That hope of inclusion, that expectation of opportunity, that hope of equity, and that expectation of equality. It's why I was so deeply involved in the transformation of McClellan Air Force Base in the wake of its closure to a business park, that my chief of staff once said that my office was all McClellan all the time. Because so many people, and I know some of you in this room experienced it, were displaced or suffered as a result of that closure decision. Enormous change and disruption in their lives. But we came through that establishing a business center with over 15,000 jobs and over 200 companies and organizations located there. One of the biggest single job centers in this region. It was that hope and that expectation that led me to be part of creating a program called Birth and Beyond, a home visitation program for at-risk families, where with the advent of that program, we were able to reduce the level of child abuse and neglect in those families that were part of the program by more than 90%. It was that hope.
not just our campaigns, but really to talk about sort of our experiences and what we've been doing. I'm a doctor. I came here, worked at UC Davis. I actually came to UC Davis because I wanted to come and really teach our future doctors how to work in communities. And because my background not only as a physician but also in public health, is I understand how important it is to reach out and to not just, as I told my residents, not just stay in the clinic and stay in the hospital, but actually to get out in the community. So if we want to really improve people's health, we have to get out into the community. And in fact, that's also what it's also tried to do with the state legislature. But as a physician, getting out in the community, of course, you can't just tell people, you can't tell students to go and do that. You got to show that yourself. And I'm proud to have been active in the community, served on the First 5 Commission, still serve on the United Way Board, helped co-found and start a nonprofit that got 65,000 children health care coverage, helped put together a coalition to ensure that we get to help strengthen the safety net during a time when the county was cutting back on county clinics, that the state was in gridlock. And we knew that not only children, who we worked, certainly had worked on through the other nonprofit, but all people needed access to health care. And what could we do to move things forward, especially at a time when certainly resources were short. And at that time, as I was practicing in my clinic and doing the community work that I was doing in the community, people talked to me about public office. Now, I never actually thought about running for public office when I was growing up. Was actually my family didn't think that was something that was really in the cards for someone who was a son of immigrants and who was from a minority. But here in this community, this is a very inclusive community, one that seemed to be able to would embrace the idea. And so people talked to me about running, and I finally thought to myself, well, if I can't throw my hat in the ring, how can I complain? So I'm proud to have carried the banner for the Democratic Party in Assembly District, what was then 5 before redistricting. This was a seat where basically it was been a Republican seat for 28 years. It was a seat that had a 2% Republican registration advantage, and in 2010, and unfortunately the lead candidate was Mr. Andy Puno, who was the author of Proposition 8. Yes. And so certainly we weren't interested in giving him a soapbox in our own state legislature to go and pass on his views there. And so I was proud to be the banner bearer for the Democratic Party. And we came together and we won that race. And the reason we were able to win the race is because we talked about how important it was that we needed to get past the gridlock, the same kind of gridlock we're seeing in Washington right now, the gridlock we were seeing in the state in the California legislature. And we need to get past that gridlock, and we need to address and solve problems, like I've done in my life as a pediatrician, bringing people together to solve problems, building coalitions, and so we were able to win that race because we had Democrats, of course, we had independents, we had Republicans voting for a candidate who wanted to work to solve problems. And I'm proud that in my short time in the legislature that I've been able to do that. I've worked hard to try to address many issues. For example, I'm proud to have authored a bill that has brought down, while we were still working with budget deficits, brought down $50 million for local fire departments to help alleviate local budgets and ensure that people have access to ambulance transport. We work to be sure we protect the public. I authored a bill to ensure that expired medications, and as well as expired baby formula, could not be sold on store shelves. A bill that actually had been another author had been vetoed before, but we worked hard to be sure that would happen. So we want to be sure we protect not only our infants, but also our seniors as well, so that you didn't have to keep checking the expiration date.